Breathing. This reading introduces some information about the physics and mechanics of breathing, which pertains to the field of kinesiology, the study of body movement. By understanding these concepts, a person's imagination and sensation about the breath becomes more distinct. This in turn also supports our yoga practice, which is based on the breathing principle. Let us begin by learning a couple of laws of nature relevant to breathing. Laws of nature. 1. The volume pressure law states that a gas will always move to a lower volume pressure, and 2. Boyle's law tells us that there is a direct correlation between a container's size or volume and its pressure. In other words, as a container increases its volume or gets bigger, its pressure decreases. The inverse is also true. In short, the more space a container has, the lower its air pressure. These laws help us understand the behavior of gases. Since air is a gas, we know it will always seek to be in a lower volume pressure. We also note that a larger container, like the space outside our body versus the smaller space within our lungs, has a lower volume pressure. By using a movable diaphragm, Mother Nature built into our breathing action the ability to change the area and volume pressure of our lungs. As the diaphragm drops, the area of our lungs and chest cavity increases, causing the volume pressure to decrease and the gaseous air to naturally flow into our lungs. Imagine that. When you breathe in, the air itself is naturally coming into your lungs on its own volition because of a law of nature. The air is helping you breathe. Now, let's talk about three-dimensionality. Three directions of movement, vertical, horizontal, and sagittal, simultaneously occur when we breathe. In the drawings above, the red horizontal line represents the diaphragm, which is the primary muscle for breathing. Following the picture sequence from left to right and top to bottom, after exhalation the diaphragm is closed and forms a crescent dome. As you inhale, it descends and changes its shape from a crescent dome to a horizontal line. This action is done in the vertical plane and is like a closed upside-down umbrella spreading when opened. But the diaphragm's vertical movement is aided by two additional movements nicknamed bucket handle and water pump. The bucket handle action occurs in the lower ribs, which widen and narrow in the horizontal plane, while the water pump action, done by the sternum at the top of the ribcage, moves forward and backward in the sagittal plane. Now that you know this information, let's take a moment to view a short animation video showing the described three-dimensional movement of breathing. So, remember, breathing expands and contracts three-dimensionally. The diaphragm moves along a central tendon on the vertical axis. The lifting and widening of the lower ribs express the bucket handle motion, taking place on the horizontal axis. And the water pump motion of the upper ribs lifts the sternum forward and backward along the sagittal axis. What is important to remember from this lesson is that deep breathing uses three-dimensional movement. An inhalation simultaneously includes the descent of the diaphragm, the widening of the lower ribs, and the tilting forward of the sternum. While an exhalation reverses these motions, the diaphragm rises, the sternum returns level, and the lower ribs narrow. When you are breathing during the yoga practice, try to imagine these movements. See if you can picture them in your mind's eye and sensorially locate them in your body. These movements are scientific facts, so it is possible to sense and feel them as they occur. This ability to sense the subtle internal movements of the body is also part of kinesiology and what dancers do all the time.